In Queensland, under Dr Jeanette Young, who's now been made the governor, a doctor faced jail for administering hydroxychloroquine. As Dr Mark said, and he was not alone, quote, if a public presentation is made advocating hydroxychloroquine or ivermectin, or even such supplements as vitamin D or zinc, the person's medical credentials are assaulted, unquote. I've mentioned many times the distinguished Australian professor Robert Clancy, along with Professor Thomas Borody. They cited Dr Satoshi Omura, the 2015 Nobel Prize co-laureate for the discovery of ivermectin. Professor Clancy and Borody argued, quote, recently, Dr Omura and colleagues in comprehensive studies on ivermectin activity against COVID-19 concluded that the preponderance of the evidence demonstrates efficacy. Professor Clancy made the point. On the matter of ivermectin and hydroxychloroquine, Craig Kelly has been right to raise awareness about these drugs and their potential to be effective in the early treatment of the disease. He then said, Professor Clancy, as an immunologist, I'm an expert, and I expect my opinions need some clear air. Of the attacks on Craig Kelly for so arguing, drawing attention to all these studies, Professor Clancy said, it's very sad when people start dragging the guy apart. It's bad enough when you drag someone apart on facts, but if you do it without facts or understanding what the argument is, it is disappointing. Well, Craig Kelly was cancelled, vilified and defamed, his political career ruined, which is why people are clamouring today for a royal commission. On the whole coronavirus response, we have been grossly deceived and damagingly misled. We won't get a royal commission because governments of all persuasions were led by the nose. As a result, thousands of people have lost their lives, estimated at 20,000 in Australia who could have been saved, but businesses have been destroyed, billions of dollars wasted. Many are living but suffering long-term related injuries via either long COVID or the misinformation of governments and bureaucrats. People have been denied access to the life-saving ivermectin, but other people are still suffering because they've lost their jobs for being unvaccinated. When I spoke on this program a couple of weeks ago to Jo Nova, she argued this was the biggest medical scandal since 1850. Why a cheap, safe drug was actively suppressed because it threatened the emergency use authorisations for all experimental vaccines, an industry worth about $100 billion. Well, now, of course, the Therapeutic Goods Administration says, oh, ivermectin's okay. But Big Pharma have taken their money. Others have lost their jobs for not being vaccinated and are still denied employment.